From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
This is National Minority Cancer Awareness Week, which focuses on prevention and treatment among populations thought to be at greater risk of developing cancer. Dr. Gupta is the medical director at Associates in Radiation Oncology, and she is a guest. Dr. Gupta, a pleasure to see you again.
Thank you.
Cancer prevention is an important goal in all populations. It becomes a little more important, it seems to me, in the minority cancer population, because very often this is an area that is underserved medically, if you will. It is one for which, if you come from a place where there is a certain kind of cancer, may not be seen regularly in this country. There are possibilities that could go undiagnosed there. There are a number of issues here that we need to think about, aren't there? Well,
we all know the obvious one, which is lack of health care, the access to health care, especially in the minority population. Being a minority myself and one of the few physicians that's actually involved in cancer treatment, I see several patients of the minority population, and first, healthcare insurance coverage, we could go on for hours about problems with that. But second of all, language barriers become a big issue. And so it's important for people who don't speak English to seek out physicians who do speak their language. And frankly, in this day and age, there's plenty of physicians of a variety of ethnic backgrounds. The other one that tends to be the least recognized is cultural barriers to cancer diagnoses. There are many cultures where women get married at a much younger age, so they tend to have children at a much younger age, so their incidence of breast cancer tends to be less. However, cultural barriers also stop these women from telling someone that they have a breast mass, or that they're having skin changes, or that they've got issues with discharge or things like that, and that goes completely unrecognized.
One of the things we know, even among the population of the United States, is that among various ethnic groups, there are differences in how cancer manifests itself. American Indians and Alaska Natives are more likely than non-Hispanic whites to develop liver cancer, for example. There are higher risks and potential problems, sort of depending on the various population segments.
Right, and we know, for example, African Americans, especially African American males, have a much higher incidence of prostate cancer than the average white male. Hispanics, although they don't have as high of a cancer incidence for the most common malignancies such as breast and prostate and colon, they have a much higher incidence of virally related cancer such as cervical cancer. So yeah, you're absolutely correct.
We've raised so many issues here, and it's really hard to come up with any concrete help that we can offer, with the exception of saying if you think there's a problem, you need to see somebody about it.
Regardless of what language you speak.
Things can be done. Dr. Gupta, thank you so much for joining us.